Hi guys, Dr. Heimlich here. Today we're going to be talking about osteoporosis, maybe dispelling some of those myths. Most Americans think that if you drink your milk, you're going to help prevent your osteoporosis. Or listen to Sally Fields, take some big pharma drugs, and that's going to take care of it. Well, nothing could be farther than the truth. Let's talk about what you need to know about osteoporosis. And there's two major activities that are going on and taking place simultaneously in your body. You have osteoblastic and osteoclastic activity. Now, osteo, it just means bone. Blast means it's going to build it up. Then you have a clastic suffix that means to chew it up. Now, old bones are supposed to be chewed up. And this osteoclastic activity creates space for the new bones to be formed. You see, most of the current drugs out there, big pharma, they're designed to slow down or stop that osteoclastic activity of the bone. That means it stops the chewing up of the bone. Now, through these drugs, new bone is built up on top of the old bone. That foundation is supposed to be torn down. And the data is true that bone density marginally thicker for the first few years because the older, weaker bone is still intact. However, that bone is going to be weaker in women and more prone to experience spontaneous fractures over 4 to 5 years. That's a problem. Then you have to take a look and say, would you build a weight load-bearing wall on top of wood that's been rotten away by termites? Yeah, of course not. Yet the commercials on TV make you almost feel guilty if you're not taking their bone-building cocktails. Now, to properly fight osteoporosis, you need to feed the bones as well as the muscles. Now, we lose about 0.5% to 1% of lean muscle mass every single year after the age of 20. Now, if we don't have that muscle strength to counter gravity, our head, which weighs as much as a bowling ball, is going to start to slump forward, associated with the aging process, get some of the Dowry's hump going on in there. So there's some things you can do, some rehabilitative exercises to help strengthen that up, to keep your posture and help strengthen up and support the spine so it can hold up that 17 pounds or plus up your head. Now let's look at some of the other causes of bone loss. Now, you've got the osteoblast activity is dominant, the building is dominant in women up to about age 30. At that point, that osteoclast activity kind of becomes more significant, although you still do have both. By the time we're age 40, bone mineral density starts to drop, and stress can cause an increase in something called cortisol, which has a catabolic effect, chewing up effect. So whether stress is emotional, result of refined and mineralized diet, or trauma, cortisol is increased. Now, this increase in cortisol will ultimately increase the osteoclastic activity, results in greater bone loss. So, in America today, inflammation, metabolic syndrome, diabetes, they're rampant. And each of these conditions is a major predictor of bone loss. I mean, each of these conditions are also associated with a phenomenon described as relative acidity. Now, the pH of blood is normally supposed to be around 7.34. And when that pH goes below that number, the body doesn't like it, so it has a compensatory mechanism in play that starts to buffer it. So many of these are mineral-based, things like sodium, potassium, magnesium, calcium, and other minerals. And they're put in these storage areas. And what happens is, to keep that blood balanced, they get removed from these storage areas. And guess what those storage areas are? Exactly. Your bones. So you can see how women in other cultures that consume less calcium yet have stronger bones. Well, they don't have that relative acidity. The factor that the women here experience. Western women, that is. Now, knowing osteoporosis is such a major issue, when should we begin monitoring a prudent diet and supplement changes? I mean, should we wait until we have some bone loss or a fracture occurs? I believe that every woman 40 years or older should be tested on a regular basis, much like, you test cholesterol or your lipid panels. And, nothing against Sally Field, but true bone health is more than just taking some calcium or some big pharma drugs. It's about the correct diet, exercise, trace minerals, hormones, digestion, blood sugar, inflammation, and systemic pH. So make sure you find a doctor that understands what I've just talked about, that's going to help manage you appropriately. Dr. Heimlich.